let me ask you something personal. How many times did you get up last night to use the bathroom? Once? Twice? Maybe 3 or 4 times? And when you finally dragged yourself back to bed, did you lie there staring at the ceiling, wondering why your body won't just let you sleep through the night like you used to? If that sounds familiar, I want you to know something important right now. You are not alone. Millions of people around the world deal with this exact problem every single night. And the vast majority of them have been told the same useless advice. Just drink less water. Cut back on fluids in the evening. Stop drinking after 6 o'clock. And for most people, that advice simply does not work, or it leaves them dehydrated, constipated, foggy, and exhausted during the day just to, maybe, hopefully, get one fewer bathroom trip at night. But here's the thing. That advice is only a band-aid. It treats the symptom, not the root cause. And if you have been following it and still waking up multiple times a night, then there is a reason it is not fixing your problem. The truth is far more nuanced, far more interesting, and far more actionable than anyone has probably ever explained to you. Because the issue is not how much water you drink. It is when you drink it, how you drink it, what you drink it with, and what your body is actually doing with that fluid once it enters your system. I have spent years studying urological health, bladder function, kidney physiology, and sleep medicine. And I want to walk you through everything I know about this topic in a way that you can immediately apply to your life. Not tomorrow, tonight. So, let us start from the very beginning, because to fix a problem, you need to understand what is actually happening inside your body when you wake up at 2 in the morning with a full bladder. The medical term for waking up at night to urinate is nocturia. It is not a disease, it is a symptom, and it has many potential causes, which is exactly why the one-size-fits-all advice to just drink less does not help most people. Nocturia can be driven by bladder issues, kidney issues, hormonal imbalances, cardiovascular conditions, sleep disorders, medication side effects, dietary habits, and yes, fluid intake timing and volume. When you understand which category your nocturia falls into, you can actually fix it. Now, the most common reason people develop nocturia as they age is a hormonal one, and this surprises many people. Your body produces a hormone called antidiuretic hormone, also known as ADH or vasopressin. This hormone tells your kidneys to concentrate your urine at night, meaning they produce less of it, meaning your bladder does not fill up, meaning you stay asleep. In children and young adults, the body produces a large surge of this hormone in the evening, which is why kids and 20-year-olds can sleep 8 or 9 hours straight without ever feeling the need to get up. As you age, this hormonal surge decreases. Your kidneys do not get the same signal. They keep producing urine at nearly the same rate overnight as they do during the day. Your bladder fills. You wake up. But here is what almost no one tells you. Your hydration habits during the day directly influence how aggressively your kidneys need to work at night. If you are chronically underhydrated throughout the day, your kidneys are stressed. They are working harder to concentrate waste. They are more sensitive to fluid shifts in the evening, and they are far more likely to produce a large volume of urine in the overnight hours when your body tries to correct its fluid imbalance while you sleep. In other words, being dehydrated during the day can actually make your nocturia worse at night. This is the great paradox that most people never understand. They restrict their water during the day because they are worried about nighttime bathroom trips, and in doing so, they make the problem worse. So, let us talk about the right way to hydrate throughout the day, because this is foundational to everything else. Your body processes fluid most efficiently when you drink it consistently in moderate amounts across the entire waking day. Not in large gulps, not in sporadic bursts, not skipping water for 5 hours and then drinking a large glass all at once. The kidneys are incredibly responsive organs. When you flood them with a large volume of fluid at once, they respond by rapidly producing a large volume of urine. When you give them a steady, gentle, moderate supply of fluid, they maintain a calm, consistent filtration rate. So, the first rule of hydration for better sleep is this: drink early, drink often, drink moderately. Front load your hydration. That means drinking the majority of your fluids between the time you wake up and about 2 to 3 hours before you go to bed. Not depriving yourself entirely in the evening, but making sure that the bulk of your daily water intake is done well before your body begins its wind-down process. A practical way to think about this: if you go to bed at 10 at night, your water intake should be tapering down meaningfully by around 7 or 7:30 in the evening. not stopping cold. Tapering. A sip here and there is fine. A full glass of water at 9:30 is not helping you. Now, let us talk about how much water you actually need, because most people are either dramatically overestimating or underestimating their daily fluid needs. The commonly cited 8 glasses a day rule is a massive oversimplification. Your fluid needs depend on your body weight, your activity level, the climate you live in, your diet, your kidney function, and a dozen other variables. A sedentary 70-kilogram person in a cool climate needs very different hydration than an active 100-kilogram person in a hot, dry environment. A reasonable starting framework is to drink approximately 30 to 35 milliliters of water per kilogram of body weight per day if you are sedentary, and adjust upward if you are physically active or sweating heavily. If you weigh 70 kilograms, that puts you at around 2 to 2.5 liters per day, which includes fluids from food and other beverages, not just plain water. Many people reach a significant portion of their daily fluid intake through fruits, vegetables, soups, and other foods without even realizing it. The point is, do not guess. And do not use thirst alone as your guide, because thirst is a late-stage signal of dehydration. By the time you feel thirsty, you are already mildly dehydrated. Instead, check your urine color. Pale straw yellow is ideal. Dark amber means you need more water. Completely clear means you may be overhydrating, which, by the way, also stresses the kidneys and can worsen nocturia. Now, one of the most powerful and underappreciated strategies for reducing nighttime urination has nothing to do with water at all. It has to do with sodium, salt. And this is where things get really interesting from a physiological standpoint. Here is how it works. Sodium is an osmotically active particle, which means it holds on to water. When you consume a high sodium meal, particularly in the afternoon or evening, your body retains fluid in your bloodstream and tissues. Then, when you lie down to sleep and your cardiovascular system is no longer working against gravity to keep blood pooled in your legs, that retained fluid mobilizes. It shifts out of your tissues and back into your bloodstream. Your kidneys filter it, and you produce more urine. This is why people who eat a salty dinner or snack on chips and pretzels in the evening so reliably find themselves up multiple times in the night. Reducing sodium intake, particularly in the afternoon and evening, is one of the single most effective dietary interventions for nocturia, not just because of the fluid retention effect, but because high sodium intake increases thirst, which leads to more fluid consumption in the evening, which compounds the problem. The same principle applies to certain other foods. Alcohol is a powerful diuretic because it suppresses antidiuretic hormone directly. A drink or two in the evening tells your kidneys to produce more urine, often for hours after the alcohol itself has been metabolized. Caffeine similarly stimulates urine production through multiple mechanisms, including its effects on kidney blood flow and its mild inhibition of antidiuretic hormone. If you are sensitive to caffeine and you are having coffee, tea, or even chocolate in the late afternoon or evening, this may be a significant contributor to your nighttime bathroom trips. Artificial sweeteners, particularly in large amounts, have also been associated with bladder irritation in some individuals, as have acidic foods and beverages like citrus, tomatoes, carbonated drinks, and vinegar-based foods. These do not affect every person equally, but if you are already dealing with an overactive or sensitive bladder, these irritants can lower your bladder's threshold for sending urgency signals, meaning it feels full and urgent even when it is not particularly full. Let us talk about something that ties this all together in a way that most people find genuinely eye-opening: the role of posture and gravity in fluid redistribution. When you are on your feet during the day, gravity pulls fluid down into your lower legs, ankles, and feet. This is completely normal. Many people notice mild ankle swelling by late afternoon, especially if they have been standing or sitting for long periods. This pooled fluid does not just sit there harmlessly. When you lie down, gravity is no longer pulling it down. It redistributes into your circulation. Your kidneys get the signal that your blood volume has increased, and they respond by producing more urine to bring that volume back into balance. This is one of the major reasons people with heart failure, venous insufficiency, or even just sedentary lifestyles experience such severe nocturia. Their legs fill with fluid during the day, and then that fluid finds its way to the kidneys at night. The simple, elegant, and highly effective intervention for this is elevating your legs for 30 to 60 minutes in the afternoon, around 2 to 4 hours before bed. You do not need any equipment. Lie on a couch or bed, prop your feet up above the level of your heart, and let gravity pull that fluid out of your lower extremities and back into circulation while you are still awake. Your kidneys will process it while you are awake and mobile. Less of it accumulates to be processed overnight. Multiple clinical studies have actually demonstrated significant reductions in nocturia with this simple intervention, and it is almost never mentioned in mainstream health advice. Compression stockings achieve a similar effect by preventing fluid from pooling in the legs in the first place. If you wear them during the day, they dramatically reduce the amount of fluid available to redistribute when you lie down at night. Again, this is a urological and cardiovascular tool that most people dealing with nocturia never hear about. Now, let us address the bladder itself, because it is not a passive container. It is an active, responsive, trainable organ, and many people have inadvertently trained their bladder to behave badly. If you respond to every minor twinge of bladder sensation by going to the bathroom immediately, you are training your bladder to send urgency signals at lower and lower volumes. You are essentially shrinking its functional capacity through conditioning. Over time, your bladder sends the signal to go even when it is nowhere near full because it has learned that you always respond. At night, even the smallest amount of urine triggers an awakening because the bladder's urgency threshold has been lowered through habitual early voiding during the day. Bladder retraining during the day involves gently resisting the urge to urinate at the first twinge and waiting a few additional minutes before going. This gradually extends the time between urination episodes and reestablishes a higher volume threshold for urgency signals. This is a process that takes weeks, not days, but it is evidence-based and clinically validated. The goal is to urinate every 3 to 4 hours during the day, not every 60 to 90 minutes, which is what many people with overactive bladders end up doing. Pelvic floor strength also plays a major role that is vastly underappreciated. Weak pelvic floor muscles cannot adequately suppress bladder contractions, especially at night when your guard is literally down because you are unconscious. Pelvic floor exercises, commonly known as Kegel exercises, strengthen the muscles that surround and support the bladder and urethra. When these muscles are strong, they help prevent uninhibited bladder contractions that can wake you from sleep even when bladder volume is relatively low. These exercises are not just for women after childbirth. Men benefit enormously from them as well, particularly as they age and as the prostate enlarges, which brings us to the next major factor. For men over the age of 45, one of the most common contributors to nocturia is benign prostatic hyperplasia, or BPH. This is the non-cancerous enlargement of the prostate gland that naturally occurs with aging in most men. As the prostate enlarges, it compresses the urethra and creates resistance to urine flow. The bladder compensates by contracting more forcefully and more frequently. Even when the bladder is not particularly full, it feels urgent because it is working harder to push urine past the obstruction. At night, when there is no distraction and the body is at rest, these contractions can be enough to wake you up. This does not mean every man with nocturia has BPH, and it does not mean BPH is untreatable. Lifestyle modifications help significantly even with prostate-related nocturia, and there are both medical and surgical options available if lifestyle changes are not sufficient. The point is that if you are a man experiencing nocturia, prostate health is absolutely part of the conversation, and you should discuss it with your physician. For women, bladder and pelvic anatomy are different, but the challenges are equally real. Women are more likely than men to experience overactive bladder syndrome, in which the bladder contracts involuntarily and sends urgent signals even at low fill volumes. This can be triggered or worsened by hormonal changes, particularly the drop in estrogen that occurs with menopause. Estrogen plays a protective role in the tissues of the bladder and urethra. As levels decline, these tissues become thinner, less elastic, and more irritable, which lowers the urgency threshold and increases the frequency of both daytime and nighttime voiding. Topical vaginal estrogen therapy has been shown in multiple studies to significantly reduce nocturia and overactive bladder symptoms in postmenopausal women. This is a local, low-dose intervention that has minimal systemic effects and does not carry the same considerations as systemic hormone replacement therapy. If you are a postmenopausal woman dealing with bladder problems and this has never been discussed with you, it is absolutely worth raising with your gynecologist or urologist. Now, let us bring it back to practical strategies because I want to make sure you leave this video with a clear, concrete plan that you can start implementing immediately. In the morning, drink a full glass of water when you wake up. Your body has been fasting for hours and your kidneys need hydration to function optimally from the start of the day. This early hydration also helps prevent the compensatory rebound hydration that many people do in the afternoon and evening when they finally realize they have been dehydrated all day. Through the morning and midday, drink consistently. Carry a water bottle. Take sips regularly. Do not wait until you are thirsty. Aim to have consumed roughly 60 to 70% of your daily fluid target by early afternoon. In the afternoon, begin to taper your intake. Continue drinking, but more mindfully. If you are going to have any caffeinated beverages, do it before 2 o'clock in the afternoon at the latest. If you are going to have alcohol, do it earlier in the evening rather than late, and drink water alongside it to offset the diuretic effect, though be aware this slightly adds to your overall fluid intake. In the early evening, be strategic about what you eat. Avoid high-sodium foods. Avoid acidic, carbonated, and irritating beverages. If you want something warm and comforting in the evening, chamomile tea, which is neither a diuretic nor a bladder irritant for most people, is a reasonable choice in small amounts. 2 to 3 hours before bed, take your leg elevation break. 30 to 60 minutes with your feet up. If you wear compression stockings, remove them at this time so the fluid they have been preventing from pooling can redistribute before you lie down for the night. 1 to 2 hours before bed, your fluid intake should be tapering significantly. A few sips to swallow any evening medications is perfectly fine. Drinking a full glass of water right before you climb into bed is going to create a problem for you in about 2 hours. Before you get into bed, empty your bladder completely. Do not rush. Take your time. Make sure you have voided as completely as possible. This maximizes the time between that last void and whenever your bladder will need to be emptied again during the night. Now let us talk about your sleep environment and sleep quality because poor sleep architecture is a hidden driver of nocturia that almost never gets discussed in the context of bladder health. When you are in deep sleep, your body is far less responsive to bladder signals. The urgency threshold is higher. Minor bladder contractions do not penetrate the deeper stages of sleep. But if your sleep is fragmented, if you are moving in and out of light sleep frequently, if you have obstructive sleep apnea, anxiety, chronic pain, or any other sleep disruptor, your brain is much more likely to respond to those minor bladder contractions and bring you to full wakefulness, even when your bladder is not particularly full. Sleep apnea in particular has a fascinating and direct connection to nocturia that most people are completely unaware of. When you stop breathing during an apnea event, your heart and great vessels experience pressure changes that the body interprets as a signal of fluid overload. In response, the heart releases a hormone that tells the kidneys to produce more urine. People with untreated sleep apnea can have nocturia 3, 4, 5 times a night, purely as a result of this mechanism, with minimal amounts of fluid in the bladder each time. Treating the sleep apnea with a CPAP machine frequently resolves or dramatically reduces nocturia in these individuals without any change to their fluid intake. If you snore loudly, if you have been told you stop breathing in your sleep, if you wake up feeling unrefreshed no matter how many hours you spend in bed, if you have a morning headache frequently, if you are excessively sleepy during the day, please talk to your doctor about being evaluated for sleep apnea. It may be the reason your bladder seems to have a mind of its own at night, and it is entirely unrelated to how much water you drink. Anxiety and stress are also significant contributors to nocturia that deserve acknowledgement. When your nervous system is in a chronically activated state, your bladder is more excitable. Stress hormones sensitize the nerves that supply the bladder, lowering the threshold for urgency. People who are under significant emotional stress frequently report worsening urinary frequency. If you go to bed with a racing mind and an activated nervous system, your bladder will be on a hair trigger. This is another reason why sleep hygiene matters so much in the context of nighttime urination. A consistent bedtime routine that genuinely winds down your nervous system, that dims the lights, quiets the stimulation, slows the breath, is not just good for your mental health, it is good for your bladder. Magnesium is one nutrient that deserves special mention in this context. Magnesium is involved in muscle relaxation, including the relaxation of the detrusor muscle, which is the smooth muscle of the bladder wall. It also plays a role in nervous system regulation. Research has shown that magnesium supplementation may reduce bladder overactivity in some individuals. Many people are mildly deficient in magnesium because modern diets are low in magnesium-rich foods like leafy greens, nuts, seeds, and legumes. A magnesium glycinate or magnesium citrate supplement taken in the evening is generally well tolerated and may help with both bladder overactivity and sleep quality. However, please discuss supplementation with your physician before starting, particularly if you have kidney disease, as magnesium is cleared by the kidneys and can accumulate to unsafe levels if kidney function is impaired. There are also medications that can contribute significantly to nocturia, and this is something many people do not even realize. Diuretics, which are commonly prescribed for high blood pressure and heart failure, increase urine production by design. If you are taking a diuretic and it is scheduled for the evening or bedtime, simply shifting that dose to the morning with your doctor's guidance can dramatically reduce nighttime urination. Similarly, certain antidepressants, lithium, some calcium channel blockers, and corticosteroids can all affect urine production or bladder function in ways that worsen nocturia. If you take regular medications and you have significant nocturia, it is absolutely worth reviewing your medication list with your prescribing physician to see whether timing adjustments or alternatives might help. Now, I want to be honest with you about something. For some people, lifestyle modification alone is not enough. If you have significant nocturia, meaning 3 or more episodes per night, and you have made genuine sustained efforts with the strategies I have described, it is time to see a urologist. Not because something is necessarily terribly wrong, but because there are prescription options, bladder-specific medications, desmopressin therapy, pelvic floor physical therapy, nerve stimulation therapies, and in some cases, procedural interventions that can make a dramatic difference in quality of life. Nocturia is not just an annoyance. Studies have clearly demonstrated that it impairs cognitive function, increases the risk of falls and fractures in older adults, worsens mood and anxiety, and significantly reduces overall quality of life. It deserves to be taken seriously and properly evaluated, not just managed with increasingly early bedtimes and bathroom trips. Let me give you the complete picture in one clear summary before we close. Drink your water earlier in the day. Front-load your hydration so that most of your fluid intake is complete well before the evening begins. Reduce sodium, particularly in your afternoon and evening meals. Eliminate or significantly limit caffeine after early afternoon, and limit alcohol, especially in the hours before bed. Elevate your legs for 30 to 60 minutes in the afternoon to mobilize fluid from your lower extremities while you are still awake. Retrain your bladder during the day by resisting early urges and extending the time between voids. Strengthen your pelvic floor with daily exercises. Create a genuine wind-down routine before bed that reduces nervous system activation. Optimize your sleep environment and get evaluated for sleep apnea if there is any reason to suspect it. Review your medications with your doctor. If you are a postmenopausal woman, discuss local estrogen therapy for bladder health. And if nothing else is working, see a urologist for a proper evaluation. The nights of waking up exhausted, stumbling to the bathroom in the dark, losing that precious deep sleep that your body and brain need so desperately. Those nights are not inevitable. They are not simply a price you have to pay for getting older. The body is remarkably responsive when you understand what it needs and give it the right conditions to thrive. Your sleep matters. Your bladder health matters. And you have far more control over both than you have probably ever been told. Take care of yourself. Drink smart. Sleep well.